Matt. It's been a long time since I've last seen you. How are you today?
I'm very well, Emmanuel, and thanks for asking. How are you today as well?
Oh, I'm very nice, thank you. Well, today I'm going to be asking you a couple of questions. Ready?
Yes, please.
So now, for the first one, does NVQ3 still exist?
Yes, it does exist. However, the term NVQ was phased out and it's been replaced by an RQF qualifications because the UK changed the national vocational system to make qualification more flexible, modern, and easier to compare. So, for those who are still saying NVQ is actually, it was an old qualification framework, but it still exists, and that's why they call it, is officially now called level 3 diploma in adult care, RQF, and the RQF means regulated qualification framework. And in this case, we have different types of the certification in the health and social care. One of it is the level 3 diploma in adult care. RQF, we have the level 3 diploma in children and young adults, RQF, and we also have the level 3 diploma in residential childcare. You know, we have a couple of them out there. So yeah.
For the third question, is a level 3 diploma in adult care or QF different from care certificates?
Yes, it's entirely different from the care certificates, and this is what I say to people, because a lot of people, especially those new in the healthcare, they do not understand the difference between the care certificates and also the level 3 diploma certificates. In 2015, the care certificate was actually introduced to ensure that new care workers, they meet the minimum standards before working independently, and it covers safeguarding, infection controls, and a lot of this. It is mainly used when doing induction. Maybe they are trying, as a new carer, you're trying to come on board into a company, they ask you to go for, those trainings, they send it to you. However, one thing most people don't understand is this: the care certificate expires within 6 to 1 year. Compare to the level 3 diploma in adult care or in the children one, the RQF. It is regulated. This is the first thing I say. It is actually regulated. It doesn't expire. And that's why we have the RQF, regulated qualification framework there. And also for those aspiring to become a senior healthcare workers, maybe experienced care staff, team leaders, you progressing into becoming a deputy manager, a registered manager, you actually need the NVQ3, which is a level 3 diploma in adult care, or if you in adult care, or even in the children's setting. And don't forget, with the NVQ3, which is a level 3 diploma in adult care, please note that it includes workplace observation, assignment, competency assessment. It's more detailed. It requires more detailed knowledge and responsibility compared to the care certificate. In this case, you can always have the care certificate done within 12 weeks. Some can even do it within 2-3 weeks. Compared to the NVQ, this lasts between 3 to 1 year. So it's so different. And finally, my last point is there is a career progression with the NVQ3. Definitely there's a career progression in this line, because once you're done with your NVQ3, you can choose to go for your 4, you can choose to go for 5, you can even choose to progress into studying healthcare courses like social care. You can choose to do social care, you can choose to go for nursing, mental health nursing, general practitioner nursing, and the like psychology. Compared to the care certificate, this is not a UCAS, it doesn't use UCAS based points, so this is what makes it quite different. And lastly, before I stop, with the NVQ3, you do not only need to use it in the United Kingdom, it is recognized well in other countries like New Zealand. I've always said there's Canada, America, Australia, and the like. So that's what makes it different from the care certificate.
Thank you. And for the last question, do you have other courses you offer at Mima Consultancy?
Yes. I know a lot of people see me talk about NVQ, because the reason is because we have a lot of requirements. People come in, I want to register for NVQ3, I want to register for NVQ2, NVQ4, and the likes. However, we do other courses like functional skills in maths and English. For those of you who are who relocated as immigrants into this country and you never had the opportunity to pass your WAEC WAEC, which is the West African Examination Council for those from Africa. Please note that an equivalent of this exam is actually the functional skills in maths and English. Also, it's also an equivalent of the GCSE here, held in year 11, if I'm correct. And finally, what I would also say about these functional skills is that with the functional skills, most organizations like NHS, they require it. If you want to come on board into their organization, they ask for functional skills in maths and English, and in most cases, universities, they also ask for this. For example, if you're looking to gain an admission into the university, they ask for functional skills, whether you have your functional skills in maths and English, depending on the course you intend to go for. Finally, I talked about the functional skills. We also do courses around constructions, business administrations, and NHS phlebotomy. Yeah, this is one thing that most people don't know we help as well. With the phlebotomy, we draw the real blood. It's actually not, we take you to a GP center or an NHS registered center where we can take, you can take your real blood from patients, and until we are sure that you know what you're doing before we release you and release the certificates to you. So, yeah. That's it. We offer all those courses. If anyone interested in coming on board to join the organization, please, all you need to do is to reach out to me reach out to the team via www.mimatconsultancy.co.uk, or you could also go to my TikTok handle, which is mimatpush.